Great. Hi, everyone. We're going to wait a minute or two and then we'll get started with our panel today. Thanks for joining us. Always feel like we need Zoom to have some waiting, holding music here. Surprised maybe that feature does exist. We'll remember that one, but. Great. One more minute while people still join us. All right, Nichola, should we?
Yep, we can
get
kick
started?
it off.
Let's do it.
Hi, everyone. Welcome. We're so glad to have you all here with some of these reporters who are writing some of the most important stories on the health industry and as health policy continues to change in DC. I'm a senior vice president here at Orchestra. I lead some of our national public affairs campaigns, particularly focused in the health space. And public affairs means different things to different people. For us, we specialize in helping our clients from major pharmaceutical companies to local advocacy groups build targeted campaigns to shape policy and regulatory outcomes in DC and in states across the country. I'll pass it over to Steph.
Thanks, Nichola. I'm Stephanie Fergione. I'm a senior vice president at Inkhouse, SVP of our health and technology practice. We work with companies in the digital health, wellness, healthcare IT, AI space. And both Nichola and I are part of Orchestra, a strategic communications and marketing firm built for a complex and fragmented world.
Cool. So let's now start with a round of introductions from our panelists. I'll let Anastassia kick it off.
Yeah, hi everyone. Super excited for this conversation. I'm Anastassia. I'm a senior writer at Fierce Healthcare. For those who don't know, we're a national B2B trade publication and we cover all things healthcare. And you may know our two sister publications as well, Fierce Biotech and Fierce Pharma. And I cover health equity and I'm mostly focused on longer form reporting.
Cool. Cassie?
Hey everyone, thanks so much for having me. My name is Cassie McGrath. I'm a reporter with Healthcare Brew. Similar to Anastassia, we are B2B, covering everything from hospitals to health plans to med tech. I'm mostly focused on our provider, policy, and tech coverage.
And we have Leanne.
Hi, everyone. I'm Leigh Caldwell. I'm with Puck. I've been there for 9 months. I was at the Washington Post before that, NBC News before that, and other places before that. So at Puck, our focus is the influence industry. And so I cover that through that I cover healthcare and other things through that perspective, whether that's Capitol Hill, whether that's through the actual industry, whether that's the lobbying influence as well, and the administration too.
Awesome. Thank you all for joining us today. We're very excited about this conversation. So I think with that, we can move into the meat of our panel today. And we wanted to start off by talking a little bit just about the healthcare landscape, because this has been a really big and crazy year for healthcare. We've had a new administration. There's been an overhaul at HHS, drug pricing reform. There's a debate on ACA subsidies. That's at the heart of the government shutdown that we're all currently experiencing. And then on the markets and funding side, it's been a more active year for health tech companies. We've had some digital health IPOs. So tons going on. And I think we just love to hear from all of our panelists, just looking back at this year, what's shifted in your coverage and what's really shaping the conversation right now. Cassie, we can start with you.
Sure, yeah, happy to start. As you said, it's been a very busy year for us. A lot of my coverage this year has focused around tariffs and the impact that's had on different markets from pharma to med tech, things like that. Lately, I've also been looking at individual state laws as well, things like data privacy, universal healthcare movements in individual states, and even executive compensation limits and things like that. But back to the federal space, lately I've been covering things like Trump RX. And then, of course, you're looking at ACA subsidies, potential Medicaid cuts. And earlier in the year, it was more of like things around, changes in NIH grants and Doge layoffs and things like that too, and how that affected the industry. So a lot of my coverage is, how X policy is affecting Y area of the industry this year. And it's been keeping us really busy.
Right. Anastasia?
Yeah, very similar. We're tracking all of those things. And in the past, we did cover policy, but we don't have like a dedicated policy person at Fierce. But this year, it's like all in on policy. Everyone is covering it from their respective points of view. We did a popular story that was like a first 100 days recap of the admin. It was like a super long, it ended up being super unwieldy because there was just so much to include. But we got really strong feedback from readers on that. And even for us internally, it's a really great reference point because there's just so much happening. So between the job cuts and also all the different leadership changes, we're tracking those at a pretty granular level, and we're experimenting with different formats. So we might have like a live blog style for hearings, and then we'll have like co-bylines where multiple reporters contribute to one story. Someone's bringing like the health tech perspective, someone's bringing hospitals. So we're also brainstorming end of year recap stories at the moment, but policy has been a huge focus for us this year, and that's being driven by reader feedback.
Awesome. And go ahead, Leanne.
No, go for it.
I just, in addition to that, I'd also love to hear a little bit from you on in this era where we've got this barrage of rapid fire changes, like as Cassie mentioned on Medicaid cuts, Trump RX, most favored nation drug pricing. There's no shortage of announcements coming out of the White House or from Truth Social. And I'm curious, in that kind of climate, how you think about which of these deserve your attention and how you're sifting through the endless options for health policy coverage.
So the great thing about healthcare is that it kind of is interspersed in every single conversation that's happening. And so it makes it really easy actually to choose how you in what ways and what you cover. So for example, when I was on the Hill covering the big beautiful bill, of course there was the Medicaid component, which was a huge part of those negotiations and that discussion. Like you mentioned, the government shutdown right now with the ACA. It is interspersed with politics as well when Senator Cassidy, who's the chair of the HELP committee, his vote was the vote to confirm RFK Jr. We saw just today, Casey Means, who is the nominee to be Solicitor General, she was supposed to have a confirmation hearing today, which she had to move online because she went into labor. And so, especially since I spend a lot of my time on the Hill, the healthcare issue is such a part of so much of the coverage. I was just speaking at a panel actually, or I was moderating a panel a couple weeks ago. And the panelists were talking, there were a couple Hill staffers, and the panelists were talking about the big health package last year that fell apart last December. And that seems like it's might be revived again for this year. And it's interesting because that health package was actually a moment that broke a lot of trust between Republicans and Democrats. And so if that is revived, it could be a really big step forward. And so the healthcare issue kind of, it just is interspersed with so many different threads of coverage from like the influence campaign, what's happening on Capitol Hill, and the administration too.
Yeah,
interesting. And Cassie, I'm curious to hear from you too around how you see these conversations taking shape when we think about health equity and health equity gaps in access to care.
Yeah, an example that comes to mind in regards to Medicaid cuts is I looked at maternal health access, which we know is, a major health equity challenge, particularly, that over 40% of people who give birth are on Medicaid. And so if there are cuts to Medicaid, um, and, also if they're in a state where there's been cuts to reproductive rights and things like that, there may be clinicians leaving those states as well. So there could be a rise in births met by a lack of health coverage, lack of providers. So that was something I focused on earlier this year, looking at like maternal health and some of the equity challenges there. But yeah, I mean, I think that we're always trying to keep a really strong focus on people who are potentially left behind by the healthcare system, which we know happens, unfortunately all the time.
Anastasia, anything you want to add
Yeah,
there?
I was just going to add, definitely there are tons of populations that are currently being marginalized. Maternity is a very important space, but there's also LGBTQ rights that are being restricted. Gender affirming care is a subject that's even been taken up by SCOTUS. And I'm seeing a lot of interest in behavioral health right now. It seems like there's a ton of focus on the industry side in behavioral health. Folks are concerned that Medicaid cuts are going to affect access to behavioral health, say for children, which is a niche but obviously important space. And just broadly speaking, in terms of equity, I am seeing also movement in the menopause care offering space, which is interesting. I think there has been, rightly so, a huge focus on maternal health over the past couple of years, and now providers are saying we actually need to expand that and serve like women throughout their lifespan, thinking about the broader care continuum, especially because a lot of women, if they have, say, a geriatric pregnancy, they can be launched into perimenopause pretty quickly after that. And there's kind of like not enough services out there to service that next phase of a woman's life. So I am seeing more companies coming out with menopause care offerings, more employers offering menopause benefits. And obviously AI, won't get into that at this point, but that is part of a lot of the equity conversation.
Totally. I think you actually teed us up really well because I wanted to dig into AI a little bit, and I think access is such an entry point for AI in healthcare that we hear about very often. And AI is everywhere in healthcare conversations. Some ways in that feel very tangible, right? Like addressing these access issues. In some ways, it feels a little bit more like hype. And I know just from our colleague attending the health conference last week, feeling like the conversation shifting more from, okay, what's possible? Like, what are all the things we can do to what should we actually be focusing on now? So I'd just love to hear from each of you about kind of what sticks out to you in an AI story. Like, where are you seeing those tangible impacts? And maybe Cassie, you can start, and love to hear too if you have any insights from being at the health conference. And I know you and Anastasia both moderated panels there.
Yeah, happy to. Yeah, so I think, I mean, we cover so many areas of AI. A lot of the approach I've taken so far is looking at specific tools like AI scribes, for example, voice agents, that type of thing, or looking at an area of the industry. I just collaborated with my colleague Caroline on a story about how AI is being used by health plans, for example. So we're trying to just like really dive deep as deep as we can on a bunch of different areas of how AI is shaping the healthcare industry. But when I look for sources, of course, I'm always looking to speak with executives in the space and understanding like what is it to, stand up a health tech in 2025. But I also am always looking for people who balance um, a good amount of skepticism and curiosity in the space as well. I think that so much of the conversation is sort of that AI is miraculously going to solve these decades old issues in the industry. Yeah, it's not realistic. And so it's more interesting to me, I think, to have conversations about pros and cons. And how specifically we're going to address those things. And some of the areas that I would be excited to speak with more people about is like, for example, the environmental effects of AI, because we know healthcare is often the first touch point for, environmental or climate disasters. So thinking about that, like offsetting the impact. And I think also just working in the data privacy space and doing more coverage around that, there's some serious cybersecurity concerns as well that it's honestly been hard to get people to have always candid conversations around that. I think often with cybersecurity, what we see is regulations, new policies come in after an incident happens, where what does it look like to build in more protections from the start with this new technology? And so I like to just kind of come at it with like a lot of different, hopefully open-mindedness around different areas of, like I said, those pros and cons of really how AI is shaping the industry. And also like, if it brings those challenges, how are, for example, hospitals, maybe gearing up their IT teams to respond to cybersecurity incidents? I wrote a story about like an AI agents and how they're more susceptible to certain kinds of cyber attacks to a point where, it's basically a robot hacking a robot. And that's just not something that I think when people get into healthcare, they think that's something they're going to have to deal with. But that's kind of where we see things moving, at least with the experts I've spoken to thus far. So, yeah, how are we planning for that? So, yeah, there's so much to unpack there.
Yes, I think approaching with healthy skepticism is always a good thing. Anastasia, anything you'd add?
Yeah, just to piggyback on that, I think at Health, everybody seemed pretty exhausted and kind of laughing about how much AI was at the forefront being promoted. Off the record, we heard from sources that what they saw being promoted at the AI Pavilion was very concerning to them. And there's a lot of discussion right now about building guardrails into these programs before they're even deployed, and who's doing that, what tech vendor is able to do that safely and is promoting safety, promoting transparency. I think that's kind of going to be the winning story in the months to come. There's also a general sense that like all these companies are offering the same thing. So ultimately, every EHR company, every health tech company is going to offer some version of the same thing. So it's like, where does it end? Where is this all going? How are you going to differentiate and compete in this landscape where like literally everyone and their mom is introducing some sort of AI feature? So yeah, I think for me, in terms of stories, I want to see a company that is going beyond the headline, beyond just launching some AI feature into the ether, is being very thoughtful about internally like vetting and evaluating the algorithms on an ongoing basis, and thinking very intentionally about how it's deploying algorithms to, whether it's administrative support or clinical services.
And
Absolutely.
Leanne, I know you just sat down with Senator Mike Rounds from South Dakota on AI policy. So I'm curious to hear from you on that and how you're approaching covering changes in the regulatory space too.
Yeah, I did. I sat down with Senator Mike Rounds last week. He's been one of the biggest proponents of AI in the Senate. And in the healthcare space, he was really excited. He thinks it's most important in the defense space and the healthcare space. He feels like AI in healthcare could really, the development there could do a ton for biomedical field, and that there's just so much growth and opportunity. And that's where he is spending a lot of his time also on the defense element of it too. Um, you know, from a regulatory standpoint, that's just like the elephant in the room. Congress doesn't know how to regulate it yet. We have the Trump administration who has been reluctant to allow to support any sort of regulation. It's more of a, go quick and go fast and get there first. But as Senator Mike Rounds pointed out last week, that a lot of this has happened, the regulatory schemes are happening in the states. Congress, of course, as we all know, tried to preempt the states from being able to regulate. That did not happen. And so, absent of any congressional federal regulation. There is some stuff individually happening throughout the country. But as far as any sort of future federal regulation, we don't see it's probably not going to happen in the near future. My colleague, Ian Kreitzberg, who covers AI specifically, he had a really fascinating piece just a few weeks ago on AI in healthcare. And about the component, the role that AI could play in the research and development component, especially when it comes to clinical trials, which is something I had personally never thought about before, and how about using AI in clinical trials can help inform the R&D component for pharmaceuticals companies in a much more efficient and cost-effective way. So as everyone here said, we're just at the advent of this, and we don't know where it's going to go and how far and how quickly and what Congress is going to do to rein it in, if anything.
Yeah, it seems the deeper we get here, the more questions we have. Which brings me to my next question, which is, I think you touched on the specific importance when it comes to healthcare and defense, and I think your point about R&D is also interesting. I'm curious from the group though, if there are other facets of how AI is showing up in the health industry that you think is really underreported on right now, or that you would love to see more coverage of.
One area that I think will become, or we'll be covering soon is probably some M&A. As others are saying, I think we've seen a lot of similar technologies come online. There can't be 50 AI scribe companies forever. So what's going to happen there? Especially now that Epic also has their own co-pilot internal within the system. I'll be curious to see just how the market shakes out about that. And I'm always looking to sort of understand what's up and coming as well. I think if I'm looking at it sort of like a trend cycle or something, I think AI scribes were probably, the top of that mountain a year or so ago, and now it's more voice agents and revenue cycle management tools. So I'm looking to see like what are the startups keen to create next, is something I'm sort of keeping an eye out for at this time.
Yeah, just to go back to the behavioral health topic that I was mentioning, we are seeing a growing number of hybrid or tech-driven behavioral health companies introducing different AI features, which I think is interesting. Nothing to the level of we're using AI bots to do therapy, but just thoughtfully introducing maybe AI-driven features. For example, you might have an AI prompt for a journal if someone doesn't know how to start journaling. You might have documentation support for providers so that you can reduce pajama time and make sure that you're still compliant with all that's required for coding and for billing. So AI and behavioral health, I think, is interesting as long as it's not, like we're literally using it to provide therapy, which states are already starting to regulate. We also see, and this was recently mentioned to me by a couple of attorneys, that because of the cost pressures on hospitals, there's like a growing sense that we need to look for diversified revenue streams. So increasingly, and this has already been a trend for a couple of years, hospitals are looking to either partner with or own a part of tech companies and to be a part of the development process and then deploy that technology. On the flip side, there are some questions that I think came out of the health conference, where it's unclear whether there are always cost savings to an AI tool. And it would be interesting to see, if these companies if hospitals or other organizations are fronting a huge upfront cost to invest in these tech tools, are they actually going to reap the benefit, and is the ROI going to play out? Is that going to be something they're going to continue to invest in for years? Because also when you invest in a tool, it's not just like a one and done. With algorithms, they change and evolve and break, and you constantly have to be evaluating and fine tuning them. So I think the cost element and seeing if this is really valuable, particularly to hospitals, will be interesting.
Yeah, I couldn't agree more on that point. I think there's been a lot of promises made so far, and I would love the more numbers that we can get around ROI and success of the adoption of different programs, because as we're saying, it's also still new. I'll be curious to get a better sense of like what do clinicians like about it? What are they struggling with? Like we already know like EHRs can add a certain amount of tech burden to providers. So yeah, are these tools really reducing that burden, and really studying that and understanding that in the next couple of years, I think is going to be essential. I think that's a really good point.
Totally. Just digging in on that, the metrics piece of it a little bit, because I think that's something we think about on the comm side too. Like, what are the numbers that we have to back up the story? I'm curious from all of you if there's any metrics that you're seeking out. You mentioned ROI. Is there anything else that when you get a story, you're like, well, I need this to really cover it? No. Anyone has thoughts there? Or just any number at all is helpful, or dollar figure.
I think any data is helpful, but like how large is the sample size and how long have you been collecting the data? And are providers like part of that process? Because if it's just like an NPS score or like how much you're engaging a patient, okay, like everyone reports that, but like what are the actual clinical outcomes and what are the long-term outcomes? That goes for literally anything, not just technology. That goes for any product.
For sure.
Yeah, I totally agree. I think like time reduction is one thing that's been promised, or Leanne mentioned on the pharmaceutical side, there's been a push to discover like patients who maybe need a medication or could benefit from a medication, I should say, that they haven't heard of, and AI can help pull patient data to try to identify those people who may be able to benefit. And so I think like if we can get a sense of, how many more patients access to medication and perhaps addressed a disease or a condition as a result. That's all really helpful. But yeah, just any numbers are really, uh, they just make such a significant difference in really articulating to our readers the change that's actually happening in the industry.
Yeah, and I'll just add like impact, any numbers that signify impact, obviously not only on the client slash consumer, but also on the employees as well. I think that that helps a reader to understand what is actually happening, because for so many people it's so esoteric still, and so many people are afraid of the impact. Some are excited about it. And so the better insight we have into what it is actually doing and affecting people is I think important, matters.
Yeah, Leanne, I think you make a really good point in thinking about how the audience is asking these questions too, and the emotions and the fears and anxieties and excitement that comes along with the ongoing development of AI tools, especially in the health space. I'd like to pivot a little bit here and actually dig into how the three of you are thinking about your audiences right now, and how you're thinking about the modes and mediums of communication we have now to reach them. The first thing I'd like to get into is, we're in a really interesting moment right now where skepticism and questions around large institutions, from journalism to corporations, is really permeating like all across the political spectrum and across the country. And with that in mind, I'm curious, like, how you think about building trust with your audiences amid so much politicization.
I'll jump in here. Only because I actually got a question about this earlier today too. So it's really fresh on my mind. At Puck, I think one of the beauty of Puck is that it really embraces a voice, that each writer has a voice and tries to build a relationship with the audience, in the sense of the audience starts to know what that voice is, and I can add a lot of context and descriptors in my coverage, which helps to also explain what is actually happening and what it means and why it matters and why people are having X conversation or Y conversation. And I think that in this fractured media environment where people don't even believe the same set of facts, in many instances, whether it's media or science or all the way, in pretty much every industry, I think that being as responsive and open and transparent and fulsome in your coverage, um, helps. And, also at Puck, my stories, it's an email subscription, come directly from my email, and people respond to me all the time. And so I'm sure I always respond to those people to keep that conversation going. And it's kind of the beauty about having a more niche audience of like influencers, people, decision makers, the Hill, and rebuilding trust one person at a time.
Totally.
Yeah, I would say similarly, well, kind of similar, but we're really lucky at Fierce because we are B2B. So our audience is people in the industry, and the industry we write about is healthcare. So for the most part, we have like pretty trustful readers. They're not coming to us because they're skeptical or they're unclear about the science. They're coming to us because they trust that we are following the science like they are. We obviously do correct mis or disinformation coming out of the administration on whatever issue, but I feel like to our readers, a lot of that is intuitive. And just continuing, like this is just a Fierce philosophy even beyond our current time, but always being the go-to source for meaningful insights that go beyond just like the daily headline, because that's really what readers know us for and come to us for, is continues to be a priority.
Yeah, very similar here at Healthcare Brew as another B2B pub, but I also think, finding really trustworthy sources to speak with, developing those source relationships are always crucial. It's sort of the big question of our industry is, we, of course, all really believe in the power of providing high quality, thorough information to people. And I think just leading with that every day and creating the things that we want to read as readers too is sort of my mantra as a person, is I just care about putting good information out there, as I'm sure others on this panel do as well, and believe that, if maybe someone will come across that and get a sense of hope and notice that there's still a lot of really good work being done. But like I said, I think a lot of that comes down to speaking with the right people and the numbers aspect too, that we're not just saying things, that we're really backing it up. Because yeah, there's still, really high quality peer reviewed research, and there's still really great studies out there to pull from. And I would also say we take a lot of pride in our fact checking process here at Healthcare Brew and Morning Brew at large too. I'm really lucky to work with such a great team of people who, are really diligently looking through everything. I don't know if any of you ever talk to someone outside of the media industry and they're like, how does that work exactly? Like, who's reading that? And I'll be like, many people.
Yeah.
It's not just that I get to, sit and write things. And I don't know how much people understand that. So just also in my personal life, I try to go out there and just share more about all the work that we do, because expertise and experts are as necessary as ever. And I feel like a really strong duty to people to continue working as hard as I can to try to, yeah, get that good information out there.
I love that. And I think it brings us kind of into this next part of that question, just thinking about how the audiences are changing. And Leanne, you touched on this too with Puck being so voice driven, but there's more Substacks. People are following, specific journalists, specific voices. We have podcasts, social channels, all of these new these channels have emerged that make audiences more fragmented than ever before. So I'm curious to hear how that level of like sprawl across media is impacting how you all source stories and think about like where a story is best suited. Is it something that you might just, share personally, or is it something that's suited for a digital health story? Or kind of on the flip side, when you're thinking about sources, do you vet people that way? Like look at their LinkedIn and see what they're talking about and find sources that way? Leanne, do you want to start any thoughts there?
Sure. Yeah, I'll start. So as far as sourcing is concerned, I find that also your individual reputation as a reporter matters a lot. I started my career in at a radio outlet, very small radio network that hardly anyone listened to. And so it was really hard to get people to call me back. People didn't know who I was new in my career as like a baby reporter. But just after spending years and years, regardless of where I work, as long as like you stay true to your principles and your ideals and kind of your North Star as reporting, I feel like that is the key to not only gaining trust with sources, but also gaining trust with an audience as well, and also building a readership too. And so, authenticity is like the word of the year in 2025, especially in the political realm. But I think it also matters for reporters too. Not that every reporter is allowed to or can have like a voice, but being very clear about your own reporting standards and ethics and how you write a story and how, bias. I don't think there's any such thing as objectivity, but perceived bias or not there is in a story. I think that all of that just matters, built on your own reputation.
Absolutely.
Yeah, I
Cassie.
think with things as fragmented as they are, it's sort of about reaching people where they are as well. And it's of course really different from when people just had their newspaper delivered and read what was in front of them. So reaching people on different social media channels, trying to make the news accessible to people as well. If that's through a video, then that's through a video. I think it's important for people to, excuse me, to learn where they can, and where they have time. And then, trying to give them the high quality information that they deserve to try to maybe reach them through other channels as well. In addition to, as Leanne was saying, like, the personal reputation, I think the publication's reputation also of, if people know Morning Brew or Healthcare Brew, they can feel comfortable coming to us for healthcare stories and stories on other subjects as well that can, give them the information that they need. So I think it's sort of about keeping an open mind about the different ways people are engaging with the news too now and trying to reach them. And, there's so many places. There's also like, I remember listening on a panel a few years ago and someone made such an interesting point about like, there's so many great things to do. Like you could, watch something on HBO. You could, go see a play. You could play Xbox or something. Why would you, in this extremely stressful news environment, choose to read a news story? So I think it's like sort of part of our job to give people that reason why, and make them want to come back for more.
So true.
I agree with that. Just to go back to like this idea of LinkedIn and how we maybe look up sources, reputations. Personally, it hasn't changed how I do my reporting. I use social media occasionally to look for like tips or story ideas, but I don't necessarily go and read like a thought leader's post just to see before I interview them. I do think that with Max Tawney is a fantastic media reporter at Semaphore, and I just love reading about the media industry. And he said in a Q&A recently-ish that the future of journalism is honestly the trades, because you have these increasingly fragmented audiences looking to increasingly fragmented different mediums for unique voices. And that's kind of where journalism's already headed. And that's kind of where audiences are already headed. So leaning into that and like leveraging the power of a niche audience is going to be the future. It's going to be a sustainable way to do journalism because these are leaders, these are policymakers, these are people in positions where they can afford a subscription or to attend an event, whatever it is, whatever your business model is. They're going to be desiring and willing to pay for your content. So I think that is like the realistic future of journalism. And obviously I'm biased as someone who works for a trade pub, but that need's always going to be around. And, consumers, obviously it's really important to think about reaching them. And maybe there's a totally new era of just like Substack and reporters who branch out from mainstream news and try to reach mainstream audiences that way. But I think from the industry side, trades are going to continue to be a very powerful source of information.
Absolutely. I mean, all of you on this call and trade reporters at large, you're the folks like digging into the stories and like getting to be the real experts in these spaces where, others maybe don't have that opportunity. So it's so important to go to you to hear those stories as well. And I think just on the note of different mediums and different ways that we're getting the stories out there, I know, Anastassia, you host the Podnosis podcast at Fierce Healthcare. So just curious if you have any thoughts of like what makes a story better suited for your podcast versus a digital piece or like doing something in tandem. I know you just spoke to Heather Landy about that alternative funding story for specialty drugs and kind of went under the hood on the reporting, which was super interesting. So love to hear more about how you think about those two mediums.
Yeah, that was really fun. Yeah, so we've had our podcast for a couple of years and we all take turns co-hosting it or hosting it. And with the podcast for us, we have way more flexibility in terms of timing and just general topics. Typically for our written coverage, it's either something that's really timely or it's like a long form investigative piece. But we do get lots of really great pitches for topics that are not necessarily timely. They're kind of ongoing or evergreen. They might be super niche, but they might be super broad. Anything that's not exactly a fit for our written coverage is great for the podcast. It's kind of in between long form and daily because we only have 25 minutes to engage with a guest. So on the one hand, you can kind of hit a ton of different points and it goes definitely deeper than like a quick daily story. On the other hand, you can't get, an hour long conversation with an expert. But we welcome all pitches like on lots of different topics. It's most helpful if you pitch a specific person and a targeted topic and why they're best suited to speak to that topic. Don't just be like, I have a random AI expert to speak about AI in healthcare. Not helpful. And what is also nice is we have flexibility with format. So as you said, I was recently speaking with my editor, talking about my reporting process and the findings from my story, but we can also have like a patient and their doctor, which I recently did to speak about an issue. We might have, two voices on opposing sides of a debate. We might have two complementary voices or like a clinician with a researcher or like an attorney with an advocate. So there's a lot of flexibility with the podcast.
Interesting. I actually would love to hear from all three of you on big picture, how you like to be pitched, what makes a pitch stand out, whether it's for a one-on-one interview, for something like a podcast, or just more broadly for a story.
Yeah, so I think that the most important thing is for the pitcher to at least understand what Puck is about and what I cover. So that is like number one, right? So we have to know our audience, and the person who pitches, I want to know their audience and the person that they're pitching. So that's it. But I will say for me, honestly, the best way is a phone call, but it's usually from someone who I have a pre-existing relationship with. A cold pitch sometimes works. It's rare. It's usually someone giving me a call and hey, I have an idea for you, and we talk about it. And that's most successful for me.
Yeah, I definitely agree with the know the audience piece. We don't write a lot of consumer focused stories, if ever. And we are more focused on contextualizing the news and trends. So that's just something important to know. And another thing, just like don't be misleading. Like I'll get pitches sometimes, referencing like a celebrity or something, and it's not like an interview with the celebrity. It's not like, and it would, sometimes that would be worth it. Sometimes it wouldn't be, but you know what I mean? Just be like upfront with your subject and who you're offering interviews with. If I feel like someone is misleading me from the top, I just don't feel comfortable working with them and trying to lead with that authenticity and accuracy, frankly. And yeah, be specific. I think as Anastasia just said, like offering like AI expert on AI in healthcare is too broad for us too. So we like to try to get into a specific trend and really like unpack it as in depth as we can. And then the last thing on my mind is just like keeping it concise. We get hundreds of pitches a day, at least I do. So it's great to have, people that I know that I'm working with. I can keep an eye out for you in my inbox. But yeah, and follow up with me if I miss you too. It's usually that I just genuinely miss someone because, it is it's busy. So I love when, especially people who I know follow up with me and, I always try to be as responsive as I can with people. But yeah, it's yeah, in that way, it's like keeping it concise in the email body can make it so much easier to just start the collaboration process as soon as possible.
Yeah, I wish that people understood what news really is. Like, just because you have a company that has like something they really want to announce doesn't make it newsworthy. And there's so much news. There's a barrage of news in this field every single day. So we're being increasingly selective. And you're like, obviously, I know most people on this call recognize that. I've had so many conversations with like well-meaning PR folks that are like, God, like the companies just don't get it. And like we have quotas and we need to send these emails out. Totally fine. But like, just to say, just because there's a product launch, just because there's like a milestone announcement, even a leadership change, like that's going to drown in a sea of like similar pitches. And that's just not newsworthy at this point for us. So if there's like a meaningful partnership, meaningful outcomes, something truly different, that's newsworthy. But otherwise, like it's just not. And unlike Leanne, I really do not take phone calls. Like I deleted my phone number from my signature because it was just so annoying. Don't call me. I'm not going to remember the conversation. I'm not going to remember that we spoke. Just pitch me by email. Don't DM me. Like, don't text me that you emailed me. Like, it's my private number. You shouldn't be calling me as a publicist. And if we have a pre-existing relationship, it's fine to follow up a couple of times, especially if you think that it's just really a great story and it's possible I missed your email. If you don't know me and you cold pitch me, do not follow up. Like follow up one time max. Most cold pitches I don't read these days as a senior writer. I'm focused on longer form reporting, and typically the best story ideas come from folks that I have a pre-existing relationship with. Your cold pitch about like some random product launch, I'm intentionally ignoring it. So please do not pester me with that. I'll leave it there.
So helpful. And I think just the range of responses to that question for us, we're always thinking like we need to protect the relationship with the journalists that we're working with and, make sure that we're building that relationship in a way that works for them. So I think what you all said really rings true for us on this call too. Great. This has been such an interesting conversation. Thank you all for the time. We're going to do we'll have a Q&A in a couple minutes, but before we head into that, I thought it would be fun to do just like a fast rapid fire round of questions. So we'll ask a question like first phrase or answer that comes to your mind. Would love to hear from each of you on these, but first, a word or phrase you want to leave behind in 2025. Leanne, anything?
Authenticity.
Okay. Cassie?
Change healthcare forever. I can't get another pitch with that.
Okay, I love that.
Mine's totally similar. Game-changing, innovative, revolutionary. Like, no, don't even bother.
Got it. Get rid of the jargon.
On a positive note, favorite news story of the year. It does not have to be healthcare.
New York Mag did an incredible series tracking the generational wealth transfer that's happening in New York City. And as a New Yorker, like it was such a fascinating read. I was completely engrossed in it.
Yeah, I'm gonna be lame and call out a healthcare series by my colleague Caroline about alternative health plans. I think it's super interesting. She wrote one about Farm Bureau health plans that I recommend. But yeah, it's so interesting to learn more about just other options there are out there on the market targeting different groups of people. And she's such a great reporter.
Mine's totally escapist. It's like the Louvre heist. And
Captivated us all.
I know. I could not understand why someone would steal something that is so iconic and easily recognizable. And I've learned so much about the melting down of gems.
Fascinating.
Great.
Fascinating.
I also liked the NY Times style piece on the detective investigating.
Oh, yeah.
So
That
good.
Great.
was good. Oh, I think Stephanie, you have one
Yeah,
more.
one more quick green flag in a pitch that you get and you're like, yes.
Personalization.
Hmm.
Yeah, this is kind of another don't, but don't tell me that your product is a magical fix to a decades-old problem. Like one thing is not going to fix it. It's just, yeah. Or also like to my professional email, I have been getting more and more pitches to my personal emails. I'm never going to respond to those. So I just think it's like a respect thing, like keep it to my professional.
We're gonna leave hyperbole behind in 2025.
I think the green flag is, hey, it's been a while, but from a very real way, because that's like, oh yeah, I do know you, someone who I actually know. Again, pitches are best from people that I have a previous relationship with, and those are the ones that I pay attention to.
Awesome.
Cool. So I think now we're going to open it up to the audience. Whether you have a question on anything you've heard today, or maybe you have another rapid fire one for this group, please feel free to share them. Okay, we have one that has already come in here. So advice for early stage healthcare companies who want to stand out in their storytelling in a crowded market. Should the focus be on the founder relationship building with media or highlighting every product innovation?
Um, I'll take this one only because I have come from so many different media backgrounds. It depends on who you're pitching. You need to know your audience. Like if you want to pitch a TV show, a TV package to NBC News, you have to have a really strong character, right? If you want to pitch CNBC, it's probably about this new innovative CEO or a product. If you want to pitch Puck, it's what are you doing behind the scenes to talk about to get members of Congress or the administration bought in. And so it just depends on who you're pitching. You have to getting back to the fragmented media, everyone has a different audience and a different purpose.
Really.
I
Here's
would
another
say,
one. Oh, go ahead.
sorry, just to add, for me, it's kind of like your products will speak for themselves if you put forward a strong founder. Like the way to stand out to me when I cover an early stage startup is it's really about like the person behind the company who like what inspired them. Do they have a unique story? Do they have a unique position? I just covered an LGBTQ mental health startup and the founder is queer, you know, like someone who's like has a personal stake and personal story in what they're building. I think that's more powerful than just like new product, new company. That's you know, it reads all kind of like the same if you're at a high level.
Yeah, I agree with that. I think also like think about it for a little bit about like what would make you click on a story about another company. Like and really think like why like think about your story a little bit more. I think it's kind of hard to say for sure because it would depend on the product for us. But yeah, if also your product is something that you notice like we've been writing about and like in the AI space, for example, or something, like I would write about a product that speaks to a larger trend in the healthcare industry for sure, even if like the personal story isn't as gripping, but it's hard to like say that there's a lot of clear rules around that just because it really depends on the trends of the industry and what we're focusing on specifically. So I know that's not like a super helpful answer, but that's the truth.
Yeah.
Another one here is, so if your company's a seed stage or earlier, are there instances where you prefer to receive the pitches directly from the founders themselves versus a PR rep? Does that make a difference?
I would, yeah, I mean, personally, I would respond to a founder who emailed me directly. I think resources can always vary, especially when a startup is new, and I wouldn't want to like shut out the potential of speaking with a founder with an interesting story. And yeah, so I don't really see a strong preference there personally.
I'm big, if you can't tell, I am big on this personal relationship thing. And so I think it's key to get to know reporters in the field and ask someone to coffee, explain what you're doing. And it might not result in a story that week or that month, but 6 months down the road, they will be much more likely to respond to your email or your phone call if you have met them before, and have some sort of base knowledge.
Great.
So assuming there is an existing relationship there, if you're getting a pitch from someone you know, would you prefer to get a suggestion for a medium up front, like, hey, this is for your podcast, or would you prefer to just get the concept?
I do like to have clarity around what medium they're pitching since we do have both. It doesn't really matter. Like I can obviously tell them myself, like, hey, this isn't a fit for us written wise, but we can spin it into a podcast or vice versa. But if it's helpful if the publicist has like a strong idea of what the coverage would look like.
Okay, interesting. There's actually many questions coming in. Let's see. What about, this is kind of interesting. So Leanne, you mentioned leaving behind authenticity in 2026. Are there ways that you identify when a thought leader is genuine versus inauthentic? Is it, I'll leave it there.
I feel like you can just tell. You just get the vibe, right? You know, I feel bad about saying leave authenticity behind because Democrats are like trying to learn how to do that still. And but I feel like it's just like everyone gets it, be authentic. You just have to you know, don't try to be a communicator like Donald Trump if that is not your personality. Like be yourself, and when you're not, it comes through. And it comes through in the pitches, it comes through in the stories, and it matters.
Yeah, just to piggyback off of that, like I think there's something sort of inherently transactional about the work that we do sometimes, but when it doesn't feel that way and it feels like a genuine partnership, and like, we're not just we're working together and we know that like there's a potential for another story after this too. It's not just like a one-off or whatever. Sometimes you can just tell like in a conversation that there's just more there, there's more to it. Like if you are just, we're just chatting for the sake of writing one story on your company, maybe that's just what happens. And like that's not necessarily the worst thing in the world. But if we have like a really good conversation and I can go back to you like when I need a source of a startup CEO or something for this other story I'm working on, like that's always so much better. So I think it's just like try to go into it with thinking like, how are we building a relationship and not how am I going to get something I want from this reporter right now? And I'll try to do the same on my end as well. I think it just can create better coverage in the long term.
I think we have time for one more question. Which industry events or conferences coming on the heels of health, for example, do you think are most valuable for healthcare startups or larger companies to be visible at?
got I got so excited at first because I was like, oh my gosh, what I'm personally like my personal favorite conference. But for companies, I don't know. I feel like health is probably the best like flashy place for a company to be. My personal favorite conference is the Institute for Healthcare Improvements Forum, which is in December. It's literally the best conference I've ever been to. I've gone multiple years. The Institute for Healthcare Improvement, IHI, they're a great nonprofit. They help hospitals do quality improvement work. They have amazing experts. They're so good at working with reporters. like I love their conference so much, but that's not a place where healthcare companies would get any visibility. So I would say health.
Yeah, it looks like I'll be attending the JP Morgan Healthcare Conference this year. So that's, of course, one that I hope to see some folks. And just like for clarity, like I love to generate story ideas at conferences and just meet people in person. So if you're there, hit me up and yeah, maybe we get a coffee.
Awesome.
Great.
Okay, team. I think that is a wrap. We're at 2:59. Thank you all so much. I'll hand it over to Stephanie.
Yeah, thanks. I just want to thank our panelists for joining us and taking time today. The work you all do is so important, and we're very grateful that you spent the last hour with us talking about all things healthcare and what you look for when you're working on a story. So really appreciate it. And thank you to everyone who attended today. Appreciate you taking the time. If you have any questions or thoughts on the panel, please feel free to reach out. And we look forward to connecting again soon. Thanks,
Yeah, it
everyone.
was a pleasure. Thank you so much.
Thank you.
Thank you.
Bye.
Bye.